The social cash transfer is a component of social protection mechanism which seeks to reduce the vulnerability of low-income households with regards to consumption as well as their access to basic services such as health, education, food and shelter, among others. So the social cash transfer was launched in 2003, and this is when the Ministry of Community Development and Social Services piloted the program in Kalomo district, and it was during this pilot that the ministry actually targeted 159 labor constrained households who had been experiencing high levels of hunger due to drought as well as high prevalence of HIV and AIDS. As of the 31st of December 2017, the scheme had been rolled out to 574,663 beneficiaries in 80 districts of the country. So the scheme is currently being supported by the Zambian government and as well as other cooperating partners such as the Department for International Development, DFID. We have the Irish Aid, Sweden, as well as the Finland governments. So the Office of the Auditor General, in accordance with Article 250 of the Constitution of Zambia, the Public Audit Act, as well as the Public Finance Management Act, conducted an audit to assess the efficiency and effectiveness of the social cash transfer program towards the reduction of extreme poverty among beneficiary households. So this audit was conducted for a period between 2014 to 2017, and the aim of the audit was to answer 4 questions, which included the extent to which the social cash transfer program had been rolled out to various districts, the extent to which the ministry had ensured that only eligible people benefited from the transfer, thirdly, the extent to which the ministry had implemented the social cash transfer in an effective as well as an efficient manner, and lastly, the developments that had been made on the beneficiaries that are under the social cash transfer scheme. So the following are the Auditor General's findings. To begin with, the extent to which the social cash transfer program had been rolled out to various districts. So the Ministry of Community Development and Social Services actually desired to roll out the social cash transfer from 50 districts in 2014 to 104 districts in 2016, but this, however, was not achieved, and it was reported that as of 31st December 2017, the program had been rolled out in 80 districts, and that was representing a coverage of 76.9% of the targeted districts. Then secondly, the Ministry of Community Development actually desired to target a total of 590 beneficiaries. However, the ministry were only able to target 574,663 beneficiaries, representing a coverage of 97.4%. Moving on to the second aim of the audit, and that was to assess the extent to which the ministry had ensured that only eligible people benefited from the transfer. It was reported that during the period under review, the audit reviewed that the ministry paid social cash transfers totaling 2,053,800 kwacha to 2,284 ineligible beneficiaries for a period ranging 2 to 140 months. And it was noted that during this the period under review, ineligible beneficiaries were put on the scheme due to a number of reasons, which included wrong targeting by the enumerators, illiteracy, as well as lack of timely verification processes. The audit also reviewed the inclusion of uncertified disabled beneficiaries on the scheme. It was, however, reported that out of a total of 8,558 beneficiaries purported to be disabled, credentials of only 76 beneficiaries were verified, while the balance, which is 8,482 beneficiaries, had neither a medical certificate nor a certification from the Zambia Agency of People with Disabilities in order to confirm their disability. So this anomaly was highly attributed to the long distances from health facilities that have qualified doctors to issue certificates, as well as the lack of the Zambia Agency for People Living with Disability presence in all the districts. Secondly, the social cash transfer audit was aimed to assess the extent to which the ministry had implemented the social cash transfer program in an efficient manner. And according to the Auditor General's report, efficient implementation of the social cash transfer program meant the disbursement of funds from the ministry headquarters to the districts within a stipulated period of time, as indicated within the social cash transfer program logic framework, as well as reviewing of beneficiaries annually, beneficiary amounts annually in order to reflect inflation, and lastly, maintaining administration costs which should be within the ceiling of 15% of the total budget amount. So the report of the Auditor General actually revealed the following. The ministry actually delayed to disperse funds in a timely manner, and it was noted that in the 50 districts selected during the audit, payments of transfer amounts to beneficiaries were delayed for a period ranging 8 to 332 days. And secondly, the Ministry of Community Development and Social Services did not regularly review the transfer amount in the period under review to reflect inflation adjustments amount on an annual basis. So the report reviewed that during the years under the review, the transfer amounts to beneficiaries were only reviewed in 2014, from 60 kwacha in 2013 to 70 kwacha in 2014, and the amount had remained the same as of 2017. Now, with regards to the provincial administration costs, the audit reviewed that contrary to the standard harmonized operation manual that requires that the ministry maintains the administration costs at 15% of the total transfer cost, a total transfer amount of 63 million was paid to district above the 15% threshold. Furthermore, between 2014 and 2017, the ministry spent administration costs of a total of above 317 million, which was 42% of the transfer value of 760 million. And this is contrary to the grant agreements, which require that administration costs should not exceed international rule of thumb of 20% of the transfer value. Lastly, the Auditor General's report aimed to assess the extent to which developments had been made on the beneficiaries of the social cash transfer program, and as a way of assessing the developments that the social cash transfer program had made in improving the livelihoods of beneficiaries, the Office of the Auditor General carried out a case study in Gwembe district that aimed at targeting 73 households, and the study actually reviewed the following developments. So the first development is that out of the 73 beneficiaries targeted in the case study, 42 as well as 19 households had 1, 2 and 3 meals per day respectively. The number of beneficiaries not owning livestock had reduced from 21 in 2014 to 6 in 2016. It was also reported that beneficiaries had a growing preference of superior agriculture assets such as a plow as compared to inferior agriculture assets such as and access. It was also reported that there was some improvements in the number of beneficiaries roofing the houses with iron sheet as opposed to roofing with grass or straw. It was also reported that there was an improvement in the number of beneficiaries building their own homes with pan or bent brick material. And the report also revealed that before 2014, none of the beneficiaries built the houses using concrete blocks. But as of 2016, 7 beneficiaries had started building their houses with concrete blocks and poles. Then it was also reported that there was an increase in the number of beneficiaries using solar energy and torches as opposed to using kerosene and candles. And lastly, the study showed that the number of households owning bicycles increased from 4 to 10, and those that owned beds increased from 14 to 19, chairs from 13 to 16, radios from 9 to 10, and that was from 2014 to 2016. So these are some of the benefits that had been recorded in regards to how the social cash transfer has been beneficial to the people on the scheme.